video, I'll be demonstrating how to administer IV medication via IV intermittent. So the first thing that I'll do is review my order and review my patient's chart. I'm looking for the diagnosis, if the medication is appropriate for them, and if the patient has any allergies. After that, I will do hand hygiene and then gather my medication, and then do my first medication check. This medication is for my patient Sheen Shredder, and then the medication's name is Cloxacillin. The dose is 750 milligrams. I have two gram vials, so I can obtain my dose from this vial. And then the route is IV, it says here for injection, and then the frequency is every 4 hours. And then it's due now, today. So the next thing I'll do is I'll do another hand hygiene and then look at my PDM. So the things that I'm looking for is the name of the drug, Cloxacillin, and then this is an antibiotic. So my patient was diagnosed with sepsis on her foot. So that's what the medication is for, antibiotic, which is appropriate for an infection. So it says here may be administered by a student nurse. And then we're looking at the dosage. So the usual is 1 to 2 gram, and the order was for 750 milligram. And then the maximum dose is 2 grams. So 750 is well below the maximum single dose. And then maximum daily dose is 12 grams. So this is every 4 hours. So 6 times in 24 hours. So 750 times 6, that's a total of 4.5 grams, which is under the 12 gram maximum daily dose. And then it says we can administer via IV intermittent. And then for a 2 gram vial, which is what we have, we're going to reconstitute with 6.8 ml of sterile water for a final volume of 8 ml and a final concentration of 250 milligram per ml. So I've already calculated the volume that we'll need to obtain the 750 milligram. So for 750 milligram or final concentration of 250 milligram per ml, we will need 3 milliliters of volume of the reconstituted medication. And then for 750 milligram dose, I'll dilute it in 50 to 100 ml normal saline or D5W and administer over 30 to 60 minutes. So I've chosen to dilute it in 100 ml of NaCl and administer it over 60 minutes because some people can have an allergic reaction to Cloxacillin, which is a derivative from penicillin, and that allows me more time to correct or prevent any adverse reactions from happening, or should it happen. And then I'll also look at the compatibility. So it's compatible with normal saline, and my patient is currently running normal saline as a primary, so that's compatible. And then I'm looking at the potential hazards. So diarrhea, nausea, and allergic reaction is what I'll be monitoring my patient for. So the next thing I'll do is prepare my medication. So I'll do another hand hygiene, the whole thing. And then I'll prep my medication. So I'll swab this for 30 seconds, let it dry for 15. And same thing with the other one. And then while I'm letting that dry, I'm going to prepare my syringe. And connect that into my blunt fill needle. And then I'm gonna draw up 6.8 ml of air into my syringe. And then inject that into our sterile water. And then we're gonna withdraw the sterile water. So we need 6.8 ml. I will tap the syringe to get rid of the air bubbles. And then make sure that I have an accurate volume. So you can see that I have 6.8 ml. We're going to inject that into our medication vial.
So I will deposit this with 3.1 ml water.
We're going to roll the vial in between our palms to make sure all of the medication has dissolved. And then I'll swab it one more time just in case I accidentally touch the top.
Now that I can see I don't have any air in my syringe and I have 3.4 ml, I'm going to pull that off.
And then, like I said, based on my calculations, to get the 750 milligram, I need to obtain 3 ml of the medication.
So we have our 3.4 ml for my 1 gram vial, and I'm going to instill my sterile water.
And then we'll tap to get rid of the air bubbles. And then make sure we have the correct volume.
Set this to the side for now. I'm just going to roll my vial.
So you can
Making
see
sure everything's combined and that there's no sediment. I don't want to get any sediment sitting in my vial. So because I did touch it, I am going to clean it again for 30 seconds like that for 15. So that's ready. And we can see based on our calculation, because we need a dose of 750 milligrams, and we now have a concentration of 200.
you can see that I have 3 ml in my syringe. So then now we'll do our second medication check. So looking at our MAR, we're looking at our patient, Shane Shredder, and then the drug is Cloxacillin. Cloxacillin, dose is 750 milligram. The final concentration was 250 milligram. So then I need 3 ml. And then I have 3 ml on my syringe. And then the route is IV. This is for injection. And then the frequency is every 4 hours. And then it's due now. So I've done my second medication check. We're ready to dilute the medication. So like I said, I chose to dilute it in 100 ml of normal saline. We're going to swab the port. And then we're going to inject our medication in.
So we're going to make sure we have the right patient. We have Samuel from Chicago, the right drug, ampicillin, and we put ampicillin in our syringe. The dose we're giving today is
And then give this a little shake. And then I've already prepared my medication label. So for Cloxacillin, 750 milligram, I have 3 ml in 100 mils diluent, so 103 ml, and today's date and my signature. We're gonna attach this to the bag. And then we'll head into our patient's room with alcohol swabs or secondary tubing as well as my MAR. So then when I enter my patient's room, I'm going to do hand hygiene and introduce myself. Hi there, my name is Alex Cruz. I'm a Year 3 student nurse at the University of Manitoba. I'm here to administer your medication today. Can you please tell me your name and date of birth? Shredder Shane. And I'm also checking the FIN number, making sure that they match. And do you have any allergies? If you're allergic to morphine? Okay, that's what I have here too. So we'll also do our third and final check of the medication. So our patient, Shane Shredder, and then I have Cloxacillin, dose is 750 milligram. The route is IV and it is due now. So we'll also assess the IV side. So I'm making sure that the primary is infusing properly and it is set at the correct rate, which it is. And then I'll also assess for any signs and symptoms of IV complications such as redness, pain, swelling, bruising, bleeding. And then we'll explain our medication to our patient. So I have the medication here, Cloxacillin. This is an antibiotic, which is going to help with the your infection from your leg bone. So some of the side effects that it can have are diarrhea and nausea, as well as an allergic reaction. So I'll be monitoring you for these side effects. But if at any time you start feeling, I'll be back in half an hour to assess you for the side effects. But if at any time you start feeling these side effects, you have your call bell, and you can let us know right away. Are you okay with me administering this medication? Our patient agrees, so we'll go ahead and administer it. So we'll open up our tubing, and then we'll hang the secondary lower, or the primary lower.
So we have our mat and we have our mini bed.
And then
So we confirm with the patient, and we can also see again that we have Simon Santiago and Simon Santiago. We confirmed his allergies as well as his MRN number, so we know we have the right patient. The right drug we're giving today is
we'll spike our bag.
and we can see we have ampicillin and ampicillin. The dose we're giving today is 750 milligrams, 750
And then we'll
milligrams.
hang
The
this.
route we're giving is IV mini bag. We have an IV mini bag for an intermittent infusion.
And then we'll swab our port. We want to connect to the port that's above the pump. That way it can be regulated by the pump.
Food is an antibiotic, and the time and frequency we're giving it is now in 2 3.
So we'll give it a swab for 30, let it dry for 15. We'll connect our secondary tubing.
We're now going to begin to set up for our secondary
And then we'll prime our secondary tubing to get rid of the air from the tube. And then once it's about a third to a half full, we'll put it up higher again. So we want to back prime to make sure that that we maintain a closed system and to prevent medication loss. So then we'll set our pump, the secondary, and our rate is 103 ml because we want it to run for an hour. We're gonna enter in 103 ml. And then for callback, we're gonna hit yes, confirm secondary, and then start. And then you see it's gonna run for an hour. We want to observe for at least 3 drops from our from our chamber. And then before I leave the patient's room, I'm gonna do an exit safety check. Make sure they're comfortable, that all of the lines are connected, and there's no kinks in my tubing. And I'm also going to document on my MAR right away, sign it right away. I am going to document on our patient's fluid balance sheet, and also I'm going to be back in half an hour just to assess our patient for side effects, and in an hour to make sure that all of the medication has infused. And I'll also program a 15 cc flush, and also when I come back I'm going to make sure that the primary is back up and running. And that's it. Thank you.